Hi, welcome. We're Group 4 and today we'll be talking to you about blood pressure 101. Listen along to the following step-by-step instructions on how to properly take blood pressure.
When taking blood pressure, it is important to follow these guidelines. Make sure the patient is resting between 3 to 5 minutes. No caffeine. No nicotine. At least 30 minutes prior. Make sure the blood pressure is taken over bare arm. Make sure the patient is seated upright. Feet on floor. Arm elevated at heart level. And make sure you use a proper cuff size. These guidelines are important to use to make sure you get a proper reading. Now Ernie will show you how to use a cuff.
Proper guidelines for placing the cuff on the patient are as follows. Making sure to align the artery mark with the brachial artery of the cuff on the patient. Making sure that the cuff is not too tight or too loose, placing 2 fingers in between so that the patient is comfortable. Now then, placing the barrel of the stethoscope 2 inches above the elbow crease line, making sure it is not underneath the cuff. Now then, placing the stethoscope ear prongs inwards. This will give a proper reading for the patient since the ear canals are faced inward. Now that you know how to properly place the cuff on the patient, Brittany will demonstrate how to properly inflate the cuff.
For proper cuff inflation, it is important that your valve is tightly closed to ensure proper inflation of the cuff. You then begin inflating the cuff to 220 millimeters of mercury. You then begin to release at 2 milliliters per second. The first sound that you will hear is the systolic pressure, which is the contraction of the heart. The second sound that you'll hear is the diastolic pressure, which is the relaxation of the heart. Once you get your patient's readings, continue releasing the valve to ensure full deflation of the cuff. When you do so, record your patient's readings.
Once the subject's blood pressure data has been recorded, it is now important to see what blood pressure category the patient falls into. A normal blood pressure category consists of a systolic pressure of less than 120 and a diastolic pressure of less than 80. This is what category your patient is aiming to be in. Prehypertension is a warning sign of high blood pressure in the future. This is the category that falls with a systolic pressure of 120 to 139 or a diastolic pressure of 80 to 89. High blood pressure increases the risk of a heart attack, stroke, coronary heart disease, heart failure, and kidney failure. This is when your patient falls into a systolic pressure of 140 to 159 or a diastolic pressure of 90 to 99. High blood pressure stage 2 consists of a systolic pressure of 160 or higher or a diastolic pressure of 100 or higher. In a hypertensive crisis, the subject has a systolic pressure higher than 180 or a diastolic pressure higher than 110. Falling into this category should require immediate medical attention.
Thank you guys for watching our video on our step-by-step instructions to the basic principles of blood pressure. Hopefully this video will help you out in your future endeavors. Thank you.